Hi, I'm Dr. Chris Doherty. I'm a fellowship-trained sports medicine orthopedic surgeon at the Agility Center in Bentonville, Arkansas. Here I'm going to demonstrate the use of a Novostitch repair device for the repair of a meniscus tear. So the meniscus is a cartilage cushion between your thigh bone and shin bone, and when it tears, you can develop arthritis very quickly. We'd like to repair them, but in this case, this patient had a previous repair with another device. In this patient, a needle was brought into the joint, pushed through the capsule, a little plastic bar deployed on the outside of the capsule. It had a string between it, and the needle was poked back in, and another little plastic bar was put out. Then they just pull tightly on the strings, but the problem is the little bars can pull through. It's hard to approximate very complex tears, and in this case, there was a couple pieces of cartilage that were generated loose, and the patient went on to fail. So with the Novostitch device, what I'm allowed to do is pass a suture around the meniscus without putting any plastic tees outside the knee and keep the suture all inside on the meniscus. This allows me to tie a knot and reapproximate your meniscus much more accurately. Again, without the meniscus, you develop arthritis very quickly. It's just a matter of years from the time a meniscus is taken out, so we want to try and salvage them as much as possible. So we've passed multiple sutures here. There's that piece of cartilage we were talking about. And then we're going to pass by pressing hard in the meniscus and pushing a needle through the meniscus, and then coming back in and passing a second needle more towards the central aspect of the meniscus. The Novostitch 2 device has two needles preloaded with a single piece of suture on it, which allows me to pass all inside the knee and tie it all inside the knee and reapproximate or repair your meniscus. So here you can see we've got a much better looking meniscus than what we started with. We've passed multiple tears without the need to penetrate the outside part of your knee. I have taken a needle here and relaxed what's called the medial-collateral ligament. I basically poked a few holes in it to allow me to stretch it out to make it easier to get into the knee. And this allows me to get better access to all pieces of the meniscus. So here you can see that lower jaw comes out. The upper jaw has a trap on it, so when I squeeze it, the needle's pushed through and captured on the upper jaw. Using this device also will allow me to introduce graft materials into the meniscus if it's missing a piece. We can restore that with a piece of graft material and or actually sew in a small piece that contains a large amount of growth factors to help us heal these tears. These sutures essentially just bury into the meniscus, get covered over with scar tissue, and follow-up video on these meniscus show excellent healing and even very complex meniscus tears. So this allows us to restore almost every meniscal tear that we come to in these young active individuals and allows us to significantly reduce their risk of arthritis.